Hello again. With this video, I would like to present functioning and structure of the heart. How does it pump blood, and how the cardiac cycle looks like, and how the blood pressure changes during the work of the heart. First, let's take a look at the structure of the heart. Of course, we have here the right side of the heart, here the left side of the heart, with the right atrium and right ventricle. Here we have left atrium and left ventricle. Blood flows to the heart from the right side through superior and inferior vena cava to the right atrium, then flows through the atrioventricular or tricuspid valve into the right ventricle. These structures here, called chordae tendineae, they hold the atrioventricular valves from flapping in the opposite direction when the ventricle contracts. Ventricle contracting pushes the blood into the aorta, here into the artery. This is the pulmonary artery that divides into left and right pulmonary arteries. Here blood flows under high pressure to lungs, it is oxygenated and returns back to heart, to left side, to left atrium via left and right pulmonary veins. Then blood flows to left ventricle through atrioventricular valve. This valve is called mitral. The other term very frequently used is bicuspid valve. Again, as in the right side of the heart, this valve is kept by chordae tendineae. Blood from the left ventricle flows into the aorta, where the aorta divides into arteries, carotid arteries, subclavicular arteries, and it flows down to the organs. The pressure that must be produced by the left side of the heart, by the left ventricle especially, is much, much higher than pressure required in right side of the heart. Therefore, you can see that the diameter, the thickness of the left ventricle wall is much, much higher. Okay. The left and right side of the heart is divided by septum here, and thanks to that, the blood, deoxygenated blood, does not mix with oxygenated blood. In this illustration, you may stop the video now and try to name all the elements, the chambers, blood vessels, and then compare it to the previous picture. But we will move on. I would like to show you the structure of the heart muscle tissue. It was outlined when we were talking about the animal tissue in general, but here I would like to show you one detail that we have not mentioned yet. We said that cardiac muscle is made of branch cells. They are striated. Here you can see the striations. They have one or two nuclei, but the very important feature in functioning of this tissue is presence of intercalated discs. Intercalated discs link cells together tightly, and inside this linkage there are channels allowing for rapid flow of depolarization. Therefore, the cells of entire muscle of the heart contract as a unit. Here with this arrow, the blood flow is presented. So one more time, the right atrium collects blood from the system, from the systemic circuit. The blood is deoxygenated and it flows into right ventricle, from which it is pumped into the pulmonary artery. Back to the heart from the lungs, the blood flows through pulmonary veins. Here we see the right ones and the left ones. Here's the left atrium. Blood flows into the left ventricle, and from this left ventricle it is pushed into aorta. I would like to focus now on the cardiac cycle, so the steps of one cycle of heart's work. The cardiac cycle events altogether, they last for approximately 0.8 seconds. Therefore, our heart beats approximately 76 beats per minute at rest, of course. However, if the heart was detached from all the nerves and hormones supply, it would beat on its own with a rate approximately 50 beats per minute. The heart muscle can originate the electrical impulse. Therefore, we say that heart muscle contraction is myogenic, so generated inside the muscle tissue without the necessity of any nerve impulse. Of course, nerve impulses modulate the heart rate, increase or decrease depending on the demand. However, the origin of contraction is within the heart. Okay, let's take a look at this illustration. This illustration starts from the contraction of atrium. It's called atrial systole. In this event, both atria contract and blood is pushed to ventricle, which is relaxed and not filled with blood completely yet. So because blood pressure inside the atrium, so here, exceeds blood pressure in the ventricle, the blood may flow into, because the valve will open as the blood pressure here is lower than in atrium. Then after this, the blood was filled, the blood filled ventricle. The ventricle contracts, so you can see that the valve closes here because blood pressure here increased due to contraction of this muscular wall. Here the blood pressure is lower. However, at the beginning of ventricle contraction, so ventricular systole, the blood pressure in ventricle still does not exceed the blood pressure in aorta. Therefore, semilunar valve is still closed. But when contraction increases, so at the top of the contraction of the wall of ventricle, the blood pressure here is higher than blood pressure in aorta, and it opens the semilunar valve, allowing the blood to be pushed into the aorta. And then the ventricle relaxes and semilunar valve closes. Closing the valves is called the lub and dub sounds. We can hear the sounds of the heart when we listen to our own heart using the stethoscope, or even if you close your ears, you may hear the blood flow, but you also hear the two sounds. They are connected with closure of first atrioventricular valve, and then semilunar valve. So with a lab and dab sounds. This graph shows the change in blood pressure during the contraction of atria and ventricles. And here you can see that during the atrial systole, the blood in atrium increases. This is the left atrium, so it's a yellow line. And some atrioventricular valve is open. When ventricle starts contracting, the blood pressure in ventricle exceeds the blood pressure in atrium. That's why this place where blood pressure in ventricle is higher than atrial blood pressure, it is the moment in which bicuspid valve closes. But semilunar valve opens only if the pressure in aorta is lower than pressure in ventricle. So this is the moment of opening of semilunar valve. In this time here, the blood flows out from the ventricle into the aorta, and because the blood has left the ventricle, the pressure decreases, and this fact closes semilunar valve. When blood pressure in ventricle drops significantly, it will open the bicuspid valve, because the bicuspid valve will collect some blood, and blood will push the valve towards the ventricle, which is already emptied. This table describes the phases, time in the cardiac cycle, and blood pressure in particular atrium, ventricle, and artery, and behavior of atrioventricular valves and semilunar valves for your use summary of the events. If you find this animation, this is available in the library of Utah University. You can see the events, all the events related to cardiac cycle. When you run this animation, you can see the contraction of atria and contraction of ventricles, so atrial systole and ventricular systole. It is atrial systole is 1 millisecond faster than the ventricular systole, and the changes in blood pressure in left side of the heart. For atrial students, this diagram is very important for you to analyze, because it shows the P wave, QRS, complex, and T wave. P is related to depolarization of atrial wall, so this is it shows the atrial systole. QRS is a change of electrical potential on the wall of ventricles, therefore it shows the ventricle contraction, so ventricle systole. And the T wave is a wave showing repolarization of ventricles. The gaps between the phases may indicate different inaccuracies in a cardiac cycle, such as arrhythmia, or if there are some elevated parts of the line, they may suggest the heart attack. I will go back to our presentation, and in this diagram, you may see the relationship between the change in blood pressure, the changes in blood volume in ventricle. So you can see that with contraction of the ventricle, the volume of blood in ventricle decreases. Therefore, blood pressure must decrease in this graph. Okay, and this line here shows the phonocardiogram, so the sounds of the heart. So here we have the first heart sound, so the lab, and here we have the second heart sound, so dub, so the closure of a bicuspid valve and closing of a semilunar valve.